Welcome, and thank you for reminding me of the time. I'm just sitting here waiting for more people to come in, but we're good. Good afternoon. My name is Susannah Burt. I am the National Prevention Network representative on the Society of Prevention Research group. And welcome to this afternoon symposium, which is, oh my gosh, not first and foremost on my head. Okay. Multi-sector collaborative prevention efforts across diverse communities to promote health equity. Okay, because you know that should be rolling off my tongue. But I'm very, very grateful to be a part of this symposium this afternoon. We have a wonderful panel that are here, both in person, and then we have two who are joining us via Zoom remote. And I'm going to go over our panelists at the moment. So we have Dr. Kaholokula, working on this, from the University of Hawaii. Dr. Adrienne Dillard, Puni, Kekauoha. Did I do that right, Puni? Okay. And both Adrienne and Puni are from the community organization Kula Nona Po'a Hawaii. So they will be our first group. They'll speak in just a moment. Then we have Dr. Ruben Parra-Cardona, who's joining us via Zoom. And he is with the University of Texas at Austin, School of Social Work. And he works with our community partner, Ofelia Zapata from San Jose Catholic Church Ministry. Is that correct? And I found out this today, she's also on the local school board. So that's very important. And then at the end of the presentations, we're going to have Dr. Iheoma, Iruka, who's a research professor in the Department of Public Policy, senior fellow at Frank Porter Graham Child Development Institute, and the founding director of the Equity Research Action Coalition at the University of North Carolina at Chapel Hill. Dr. Iruka will be leading the discussant at the end of these presentations. So first, I'd like to welcome up Dr. Keawe. I'm going to keep practicing. Kaholokula. I'm going to keep practicing to talk about their project.
We purposely gave her the hardest name, so she had a hard time. But that was great. Thank you so much. You actually said the name really well. Aloha mai kaho. Aloha, everyone. We're so happy to be here. Thank you for joining us in the afternoon. It's always the hardest time in the afternoon after lunch. I really appreciate it. I have the honor of, let me turn this on. Does someone control the? Yes, he's going to take that. All right. Yeah, there you go. So I have the great honor of presenting with my two colleagues, Dr. Adrienne Dillard and Ms. Puni Kekauoha from Kula Nona Po'a Hawaii, a nonprofit organization serving homestay communities in the urban area of Honolulu, Oahu. And I also have the task of sharing our 18-year journey, kind of the timeline to give you a sense of where we started, where we've been, and where we're heading into the future. But the real talk is from them and from their perspectives about the benefits of community-based participatory research in addressing issues of health inequities among Native Hawaiian and Pacific Islanders, and what CBPR can do and what communities can do as a result of participating in this process. And I hope that when you leave here, one of the clear messages you will get is that we need to change the idea of CBPR always residing with the academic partner as the organization or the partners that receive funding, to that where our communities are now receiving the funding. And you'll hear that journey and that process. I'd like to start by, we tend to think that a lot of the things we talk about today, such as CBPR, is as if we just invented or coined those terms recently. But our ancestors actually did things that were similar way before Western science came around. And this olelo no'ea, or proverb from Hawaii, you can see the translation up there. Not all knowledge is acquired by one school. It really speaks to the importance of having different perspectives, diversity, that really drives addressing the issues that are most pressing to our communities and to us as a people. So I want to share that with you to start off on a cultural way. What I want to first share with you is where our journey began back in 2005. And it began with these partners here and others that unfortunately are no longer with us physically. Uncle Henry Gomes, Uncle Charlie Rose, another person that's also, oh, she's here, so I'll go over this. So Partnerships for Improving Lifestyle Intervention, or Pili Ohana. So Pili is an acronym, obviously, for what I just said, but Pili in Hawaii means to come together, to adhere to cling to. Ohana is family, and family is just not the immediate family, the biological family, it's the extended family. So Pili Ohana, connecting families and communities together. And that was really the spirit in which we came together. Back in 2005, we invited, or we had set the table for 10 community organizations to come and talk about their most pressing health issues. And of the 10, 5 wanted to participate in a research project, a CBPR project. The other 5 couldn't at the time because of other reasons, but they ended up being our community advisory group. So all of them ended up actually participating in some way. But here are the participants up here. We had Hawaii Maoli. Hawaii Maoli is a nonprofit organization attached to the Association for Hawaiian Civic Clubs. If you don't know, it's actually the largest and probably the longest running civic clubs within the United States. It was established in the 1800s under our Kingdom of Hawaii, but it continues today. Ke'olomamo is a native Hawaiian healthcare system on the island of Oahu. Auntie Claire Hughes was the lead for Hawaii Maoli. Dana Palakiko for Ke'olomamo. We had a Kokua Kalihi Valley, which was a federally qualified community health center, predominantly serving Pacific Islanders. And that was led by Cheryl Yoshimura. Kulonana Po'e Hawaii, and you'll hear more from today, as well as the Department of Native Hawaiian Health at the Johnny Burns School of Medicine at the University of Hawaii at Manoa. This was our partnership, a very diverse partnership. It represented federally qualified community health centers, Native Hawaiian healthcare systems, grassroots organizations coming together to address a common concern. And at the time, it was obesity and obesity-related issues, such as diabetes, that we wanted to get a handle on, and really to address obesity by preventing the diabetes, heart disease, other medical disorders associated with obesity, but do so in a culturally relevant, responsive way, addressing the social determinants of health that are impacting the people in our communities and their ability to live healthy and well as they want to. And so we needed to consider all that. What I want to share with you is our mo'oku oho, or our genealogy, our lineage, our community-based participatory research and lineage. Again, I said it started with Pili Ohana in 2005, 2017, with funding from the National Institutes of Minority Health and Health Disparities. Now, they no longer have this CBPR program, but at the time, there was this 11-year initiative in which you could apply for 3 years of planning to get to know your communities, work closely with your communities, 5 years of an intervention being tested, and then additional 3 years of dissemination implementation research. And it was fabulous. I wish they would bring it back, or NIH would consider having this mechanism again. That's how we started. And we could do it right. We spent 3 years working together, really building our strategies. What are we gonna do? How are we gonna do it? We utilized all the community resources assets. It was really community placed. It was delivered by community folks, working in these different settings, led by community folks and so forth. And you'll hear more from them. That really started us on this journey. And we were both learning. I was a new faculty back in 2005. Just came out of my clinical residency, and I was newly minted as an assistant professor. Didn't know what I was doing. So I learned a lot from these guys. And so we started our journey with Pili Ohana. And that took us all the way out to 2017. And we were able to do, so I'll come to that soon. I'll just stick to the lineage here for now. And then after that, not too long after that, Papakolea, Kulonana Po'e, got their own grant through the Administration for Native Americans to address the educational needs of the people in their community. Kawaihona Ake Aloha is the name of that program. And they were able to develop, one example, firemen, or people interested in the fire profession, putting out fires. And a lot of young men in the community especially. And they had a lot of retired firemen. They utilized their community resources to develop this program that really led to other educational training programs. And I'm not sure if they're gonna touch on all of these, but I just wanted to share a few with you. And then fortunately, we went on to have other projects, as you can see here. For the sake of time, I'll just highlight a few. One of the ones that we're most proud of, because we went from culturally adapting. Pili Ohana was a cultural adaptation of the diabetes prevention program. And that's what we mostly do, right? We take something that was found efficacious in some other group that usually is not as efficacious in a new group, but we go ahead and culturally adapt it, call it a new name maybe, and add a different surface kind of changes, right? but often we know it's not as effective, or the effect sizes are usually smaller than what is originally intended to. And when it starts to go beyond the actual sample for which it was tested on, it starts to get questionable. And so we adapted that. We were successful, and we did find it was effective in reducing, helping people who are overweight to lower their weight and lower their blood pressure and so forth. But we really felt, as part of the CBPR, is, the community's benefit is, how do we provide something that's actually interesting, sustainable, and relevant culturally to our communities? And cultural adaptation is not going to do it. It's not something designed by the community. And one of the things we did was we took our traditional dance, hula. Yeah, not the kind you see on TV in Waikiki. That's for tourists. That's what tourists see. The actual hula is quite different. And we said, can we leverage that for health promotion? And we did. So the project up here that you see, Olohoika Hula, is the name of the intervention, Restoring Life Through Hula. And that was funded through NHLBI, National Heart, Lung, and Blood Institute. And that was a large study to test the efficacy of a hula-based study for Native Hawaiians with high blood pressure uncontrolled. Could we get them under control and also reduce their 10-year risk for cardiovascular disease? And we compared that to actually a waitlist control, education-only waitlist control. So everyone got the intervention eventually. And what we found was that it was remarkable. We got people who were uncontrolled, 140 and above systolic blood pressure, where the intervention group, they started to get below 130, whereas the control group didn't quite reach. I'm not presenting that for the sake of time, but give you an idea of the power of a culturally grounded program, because often the paradigm is it has to be some Western focus or develop with Western theories, and then we have to adapt it for new groups. But here we took basically a traditional practice, leveraged that as the foundation, and we got remarkable results. So much so, and I'll skip ahead in time, that we're now part of NEAR, Natives Engaged in Alzheimer's Research, in which we got impressive results that colleagues here at Washington State University said, have you thought about using hula to address issues of Alzheimer's and other related dementia in Native communities? Because we see Native communities, Alzheimer's and other related dementia is going up. Also, we have earlier onset we're seeing in our communities. And if you don't know, studies are finding that addressing the vascular risk factors through lifestyle changes can actually hopefully prevent, if not delay, the onset of Alzheimer's and other related dementia. So we're now just starting. We're going to probably hopefully recruit and implement our hula study this summer. And we're hoping to have equally effective for addressing the vascular risk factors of Alzheimer's, but also looking at whether or not we improve cognitive functioning. So we're going to recruit people who have subjective and mild cognitive impairment. But this is all done with community partners, all done in the community by community partners. And the hula instructors, or hula masters that are doing these, are all from the community, right? So they know the communities well. And this are the things we've been able to do. And you can see, I won't go over everything, but on the top is what on the academic side, we're awarded these grants on behalf of the partnerships. But below is actually the things that they obtain over time. And you can see the number of federal grants from federal agencies, from the Administration of Native Americans to the National Cancer Institute, to the US Department of Education, and again, another ANA grant, and National Institutes of Aging. We just submitted a R01 for funding to look at home gardening for fruits and vegetables in our homestead communities as a means of increasing fresh fruits and vegetable consumption, as well as addressing nutrition-related health issues. And this is kind of the journey we've been on. It's 18 years and we're still around. And hopefully they'll share with you kind of all the benefits to doing CBPR for communities. But I just want to highlight real quickly some of the advances we made health promotion for Native Hawaiians and Pacific Islanders. Again, we were able to translate the diabetes prevention program for Native Hawaiians and Pacific Islanders that have been used in Arkansas, have been used throughout the United States with other Pacific Islander communities, and even in Aotearoa, New Zealand, with Maori and other Pacifica there in New Zealand. So we're very proud that we've been able to, that work has extended internationally. We've been able to develop a unique family and community focused weight loss maintenance program, excuse the typo. And if you, as you know, we're all going to lose weight. We can try, we can gain them over our lifetime, right? That's the hard part, is keeping it off, right? So how do we help people keep it off? And we design a family and community-based program. And we found that to be highly effective compared to a standard behavioral intervention delivered in a randomized control trial. We also developed a worksite wellness program based on the DPP program. And Partners in Care Diabetes Self-Management Program also have shown efficacy compared to standard care in improving within 3 months the A1Cs, or the average blood glucose of our participants who have uncontrolled diabetes. And again, we developed the Hula project and other projects that we're doing right now. But lessons learned, this is from the academic side, my perspective. You're here, our community partners' perspective. And over 18 years, I really switched my thinking, because I came out, book smart, I guess, but not really real world smart. So I learned a lot from these guys. And what I learned is really this: nothing that you learn in school. We need, CBPR can lead to sustainable and sensible solutions to addressing health inequities because of the wisdom, knowledge, and experiences of community leaders, advocates, and members like the two you hear from today. And that we can leverage community cultural assets versus the traditional approach, which is trying to overcome deficits. And then we can expedite the time it takes from basic discovery to real world application. I think you all know that it takes an average of 17 years to get into real world practice, and only a small percentage actually gets that far. We need to change that. And we're going to change that through these kind of partnerships. And we found that we can expedite in 18 years. It didn't take us 18 years to establish all this. We just jumped from one project to the next after we established the efficacy of different interventions. And all of them are in real world settings now. They're being used in many community health centers. Queens Health System, one of our largest private hospitals in the state, is utilizing our interventions in their community settings. They're offering hula in Waimea, Hawaii, on one Hawaii island, on Oahu, and so forth. So they're actually getting out, they're being disseminated, implemented in real world settings because they are of value to our communities. You can improve recruitment and retention of hardly reached communities. Not hard to reach. It's not like they're hard to reach. They're just hardly reached. But we're changing that. And Native Hawaiian and Pacific Islanders who did not participate in scientific research are now participating in scientific research that benefits their communities. We're uncovering the potential of culturally grounded prevention strategies, again, shifting the paradigm and improving the reputation of science in the academy. And we need to improve the reputation. As you know, we have a racist history of science and medicine that has a lot of wrongdoings against communities of color, especially indigenous people. And so we need to change that. And we're only going to change that through sincere efforts by participating with, working with our communities to do this work, and work that is really meaningful. And not only develop community capacity, but academic capacity to also do the research that matters. We often talk about how we're helping the community. The reality is they're helping us to make our work relevant. So we need to start changing the narrative to be away from being so academic centric. We're talking about how it's, that we're doing this great thing. It is really a two-way street here. And we should start talking about the value they bring to academic and the scientific process. And again, it leads to lifelong partnerships and friendships, such as the one we have developed over 18 years. So I just want to end with this slide here, because with our community partnerships, we are developing the next generation of health disparities researchers. We are growing our own from our communities. And you see a number of them up here from different parts, two different universities, as well as from different departments and professions and disciplines. And they are all at different stages in their development towards becoming independent researchers. And we're hoping that they will continue the journey that we started, and that they'll be our future. So with that, I'd like to turn it over to Dr. Dillard, you first.
Okay.
Dr. Adrienne Dillard, I'm gonna stand here and do your slides for you.
Okay.
Could we have her also live on that one? Sorry.
Aloha, I'm Dr. Adrienne Dillard. I am the Executive Director of Kulanonapoi, Hawaii. I am not born and raised Hawaii. I have been there more than half my life. I am friends with Puni Kekauoha, and I have been in community 30 years, doing her a favor for a minute, which is, we talk about in doing this work, it is really the foundation of trust. So as we started on this journey for community-based participatory research, one of the things that we always focus on is it's about those relationships. When we began with Pili Ohana, one of the first things that we were told as we looked at partnering with academia was, one day you too will be able to take the lead on an NIH grant. And we started looking at, okay, what does that look like? And where do we begin? And one of that really highlighted the need to build capacity. Around 2008, Puni and I had the conversation of where do we begin and who's going back to school, because we were all in community doing community work for a number of years without degrees, but we felt we had been challenged and we were going to step to the challenge. I returned to school in 2008 to get my BSW in social work. I went on to get my master's and got my PhD in 2018, which we call the Village PhD, because it was with the intent of us continuing to do research and building the capacity of those in community to do the work that we do. So when Keawe showed you the timeline of what we were doing and the things that we've been able to accomplish, to me, one of the big things is, although we've not gotten to that, we're taking the lead on an NIH, we've gotten to the point where we are contracting academia to work with us on our projects, that we've flipped that over. So when we have on our timeline the Homestead Health Survey, we contract the university to work with us, for us to help our friends and other communities look at acquiring their data so that they can understand the challenges that they need to meet, because we learned early on that's very important. When we started looking at other projects, it was about when we worked with the schools and Department of Psychiatry came in, we contracted them to do our evaluation. And so it was in this point of doing research that we learned early on, we get the voice of our community by collecting the data and coming up with the understanding of what it is, the challenges, and how community would like for us to address it as we continue to partner in other ways with the university. But we feel that this is reciprocity is very important, and when you're doing community work. And so we've never felt that we should put ourselves in this place of just waiting for people to do and building our capacity. We learned that we are building the capacity of others. We bring in university students from social work, practicum, public health, and nursing to come into community so that we can train them how to work in community and with community. And so we've been on this journey, the 18 years, and feel that we have given just as much as we've received as we've moved forward to move our community forward at the forefront of addressing health and education, looking at community-based participatory research as a way to not only have us recognize that our capacity can be built, but that we have the next generation of leaders and researchers that are being trained to recognize that we can't continue to do work in the same way, and we continue to evolve. And with that, Puni and I have to play off with each other, tag, because we can't just do that one thing like academia, all of that. I'm in the middle, I'm community, and I'm over there on that side, but we really have to do this our way.
Yeah. Can I just check in? Do I need to do the
No,
slides?
you can come sit.
Oh, okay, all right, thank you.
Oh, you need to click it.
Huh? Oh, no, I'm sorry, we putting you back on the, we gotta sit.
You see, that's a community does, right? There's no
He
Keawe.
Okay, I'm
just
staying here
together,
then, I'm
the
just
department
staying
over there.
See what happened? Are they bossing me around?
Aloha, aloha, my everybody. Aloha. My name is Puni Kekauoha. I am the daughter of Kahale and Brenda Kekauoha, who are Hawaiian homestead lessees in the homestead of Parra-Cardona. Parra-Cardona Hawaiian Homestead Community is the only homestead since 1934 that has been part of the Hawaiian Homes Commission Act, a federal act that was established by the US Congress in 1920 that set aside 200,000 acres of land across the state of Hawaii for Native Hawaiian people. And our community was again established by Kupuna. This community, you know, due to our history, Native Hawaiians were literally taken off of their lands and they were moved off their lands. And this particular group of Hawaiians moved to the hills of Parra-Cardona in Honolulu, above, practically in the middle of Honolulu, on the hills, on the hillside. And there were about 69 families at that time in the late 1800s. And this group of Hawaiians and others, there also were Filipino families, Japanese families, came together to look at, you know, how can we secure this 167 acres of land that we currently live on? So they, with the help of our ali'i, Princess Kekaulike, and a Native Hawaiian scholar by the name of Thomas Maunupau. They learned how to civically engage to create, our history and our story in order to become and petition the US government to become part of the Hawaiian Homes Commission Act. Today, Papakolea is known as the only Hawaiian homestead that advocated in that way and that actually had people residing on that land prior to becoming part of the act. So the history of Papakolea is very valuable to me as a Native Hawaiian. And I am a homestead community leader for over 30 years. I've moved back home to take care of raise my daughter. And since then, the kupuna, the elders, they literally brought me into the hall and said, come sit here. We don't have enough people to make a quorum. And so come and make a quorum. And from that day on, little did I know that they were pulling me into leadership. And I did. So 30 years later, here we are today. I'm the Associate Director of Kula Nona Po'e Hawaii. We are a community-based nonprofit organization, 30 years come August this year. We just realized that. But we've been doing work in Papakolea to help to address the health and education needs of our people. There are roughly 2,000 Native Hawaiians that live in Papakolea, about 420 homes. 35% of the people in Papakolea are elders. And we define elders as 55 years and older. So we primarily serve a lot of what we call kupuna in our community. So what we wanted to share with you today was in our journey really is about sharing hilina'i. Hilina'i is a Hawaiian word that means trust. And it really implies a really deep sense of confidence and belief that we have in one another. I need to believe and I need to trust that Keawe and everybody to my right, I can trust to come into the community and treat our people respectfully and do what we need to do in an honorable manner. Yeah. So it is my kuleana because whenever things go wrong, I get the call. I'm the one that everybody calls when something screws up in community. And so it's my very deep responsibility to make sure that things are done right. So hilina'i, this 18-year journey really started with Keawe. But in this journey, we had two sets of people. We had the universities who we have students every semester who come in to do their practicum. We get about 40 a semester from 3 different colleges or universities. And then we have the researchers. So we take them through a journey. We developed a cultural competency curriculum called Kokua Na'uau, and it's a service through learning. And in this curriculum, everyone that comes through Papakolea must complete this curriculum, which includes who we are as a people, our community, our Native Hawaiian health status for Papakolea and the Native Hawaiian community in general. And it also includes our traditional healing practices. And it includes safety, cultural safety. And in this process of students, and they can't go out onto the street or into homes until they complete the curriculum. It also provides, we have an opportunity to teach and share with researchers and students how to behave when you enter a Hawaiian community. Okay, she's saying we only get 23 more minutes. Okay, so we're going to take hilina'i as an acronym. We're using it here. Okay, Keawe, quick. Because I gave you guys too much history on the front end. Okay, click.
You want
Next one.
Next one.
So H.
H.
H stands for.
All right, there's H.
No. H stands for history. Yeah, so like I said, history is very important. When you come into the door, you need to know our history. Yeah, it's very important as Native people that those who come into the community know who we are and where we come from. Okay.
Next one,
I.
That's right.
I introspect. Basically, it is really looking at, that personal, professional, and organizational biases. We want everybody to come in and know you got your own stuff. Come in with your stuff and we're going to help you figure out how to work it in community. We're not pretending that we don't all have it. But when you come in, we're going to help you put it in a place and know how to work within the community.
L.
Yeah.
Got it?
Yeah.
So L is learn. Yeah. So in CPPR, it's all about co-learning. right? It's what the University of Hawaii will learn from Parra-Cardona and what Parra-Cardona will learn from them. So we share. So there's constant learning going on, and we enjoy it because we have fun. But when it's time for us to be, look at processes, look at the research project, what are we trying to get to? We have to be open to learning, and we also have to learn from our kupuna. Okay, Kelly. I
Just disappeared. I involve self in community activities. This is the big thing for the researchers. Don't come with your research if you've never come with anything else. And that's very important to us. Come to do screens, come to do kids, come to tutor, come to do everything, then come with your research. Because if you don't have a relationship, we can't help you build a relationship out of nowhere just about your research. So we really say that most of those who really do well in our community have come before they come with their research, and they show up for things. Over the 18 years, Keawe is our friend. A lot of those people on the journey are our friends now. And so we like the friendship and the relationship. That's very important. Be involved.
Introspect.
No, we did introspect.
Where?
He's
We
over
did?
there.
Where
Yeah,
is it? Oh, nurture.
I cannot see that far.
Nurture.
She lost her glasses. Okay,
Nurture.
nurture.
We have 20
Nurture.
seconds.
Okay, so nurture is nurture, right? Nurture is to malama, to take care of everybody, make sure we're all good. Yeah. And then act.
Do it.
Just
If
do
you
it.
say it, do it. Don't leave us hanging for stuff you said you're gonna do and you don't do. Follow
it.
through. So in
Right.
all of that, and that's about building that trustful relationship. And that's how we've survived a very good relationship for 18 years, where we have accomplished really good things, addressing from KK to Kapuna, from children to elders. We have accomplished good things, and we will continue to do that. And we have a staff of young people who will take over. We're planning our sunset. They keep saying y'all not going anywhere, but we are. And we have students that have come in that have remained. But most importantly, in this research journey, we've learned that if you're not building a relationship, you'll never figure it out. And you'll only be doing research to do research, and you'll never really learn, because a lot of times we don't see the fruit of our labor for years.
Dr. Dillard, we have one more I, and then we're done.
I,
Yes, I.
insurrect. Okay, that's on you, Puni.
Insert.
Yeah,
So
that's the deep one.
that's a deep one. Okay. So this Interact is about relationships. So, in our journey, we've had projects, research projects with other community groups like Pili and, and other projects. There's challenges. Yeah, there's challenges that go on in this process of working with academia. What we've learned is not so much the challenges we have with academia, it's the challenges we have from community to community. So, the practice or the Pili Ohana project that had 5 community groups, there was a struggle to, for community groups to work together and such. So from our perspective, the challenges has been within our own communities as we moved along in research.
Mahalo.
Thank you very much. Mahalo.
Thank you so much. We really appreciate it. We now are going to go to Dr. Parra-Cardona. Ruben, are you on?
Yes, I'm here. Can you see me and hear me?
Well, I can hear you. We're going to transfer over to you in just a second.
Okay, great.
Okay. We think we are. You're going to control the slides, correct, Ruben?
Yes, I will.
Okay, great.
Okay, great. So I'm there, right?
Just a moment. We're waiting. There we are. Yay.
Perfect, perfect. Well, hello, everyone. I really miss being in person there, but as my doctor would say now with COVID, the well-behaved people are falling in a way. So we're recovering from COVID, and I really miss being in person with all of you. I would like to thank SPR for this space, for all the organizers of this event, and I would like to thank all the amazing co-presenters, and Ofelia Zapata, who's holding the fort for us in representation of our work in the community right there. So I will talk for the next few minutes about our program of research, how we started the program of research, and what was the motivation behind starting this program of research. and the focus population that we've been working on for 16 years already. And then we'll transition to this collaboration, extraordinary collaboration we have with Ofelia and the amazing Catholic community in Austin. So now I'm sharing my PowerPoint and you should see it. Can you see it?
Yeah, yes, we see it now.
Okay, great. So throughout my clinical training as a parenting researcher, I was always concerned about providing services to ethnic minority populations, and particularly immigrant Latinos. Why? Because immigrant Latinos in the United States, they do so much for this country. We see them everywhere. We see them in construction. We see them in meat processing plants, in the agricultural fields. However, Latino immigrants are also exposed to historical injustices that are tremendously intense. And most recently, with the previous federal administration, we saw tremendous violation of their human rights. So one of the most difficult questions we have as we offer parenting groups in the community is we offer so much to this country. We pay our taxes without receiving any benefits. We cannot access Medicare and Medicaid because that's restricted to citizens, permanent residents. Why is it that we're hated so much? Why are we hated so much? So the focus on parenting very much started because out of several times in which I was subpoenaed as a clinician in training, every time that I represented youth of color, they received harsh sentences, even for offenses like smoking a joint of marijuana. The only time that I represented a non-Latino white adolescent, he was given probation, he had a private attorney. And at that moment, I realized how pervasive structural racism were in the justice system. At that time myself, I was an immigrant. I realized that devoting my life to changing the justice system was quite a challenging endeavor. But that's when I turned to offering prevention programs in Latino communities as a way of reducing the possibilities that youth will engage in the justice system altogether. So that's where the motivation for parenting intervention comes, but also parenting interventions that are grounded in evidence. That's when I had the great privilege of coming across Jerry Patterson, Miriam Furgach, and the amazing Family Generation PMTO, which is the intervention that we have adapted over 16 years. It's a very strong evidence-based intervention with very, very solid effectiveness data. And that was precisely the way in which in the beginning of my research career, I said that's a contribution I can offer to communities. So families reduce the possibilities that their kids will engage in the justice system as a result of having a nurturing and effective parenting practices. But how to go about that work without falling into scientific imperialism, right? Because it was an intervention, original intervention adapted for non-Latino Euro-American populations. So how do we engage in this work without replicating scientific imperialism? I'm a native from Mexico, so I was exposed throughout my growing up years to the ways in which the United States promoted a very aggressive capitalism in Mexico and Latin America. So I was worried about that. But when I saw the data on the parenting trials, that's when I realized that was an intervention we had to offer to our Latino communities. Now, you see these churches here. I have been so privileged and with the opportunity to collaborate with two tremendous faith-based organizations, Holy Redeemer in Detroit, you see on your left, in San Jose Catholic Church in Austin, which Ofelia is the leader of the social justice ministry. And why do we put the word safe haven there? Because faith-based organizations are truly a safe haven for immigrant communities. But faith-based organizations are the ones that many times are at the forefront of the fight for human rights of immigrants, particularly those of undocumented status. So in our process of cultural adaptation, before we deliver parenting intervention, we have a period of learning from the community to make sure that our adapted interventions resonate with families and are contextualized according to the challenges in the local communities. So you can imagine I will never forget when we started working in Detroit, we were gonna implement a focus group to learn from parents. And there was Ofelia with the social justice ministry before going into the focus groups to learn about the parenting experiences of parents, coordinating a workshop to prepare families for deportation. That broke my heart. That broke my heart. But it was at the time of the Trump administration when we knew families were at high risk of being deported. So there's Ofelia with the team of attorneys and the team of community organizers helping families with legal advice, counseling in the trenches, doing the work that very few people were daring to do at that time. That's been our experience with faith-based organizations. It's not only the refuge that immigrants identify in these organizations, but it's the tremendous advocacy that these organization represents thanks to the courage of people and leaders like Ofelia. And with regards to the cultural adaptation, La Cultura Cura, culture cures, our job has been to adapt an intervention in a way that is culturally relevant, but also overtly addresses discrimination and the way in which discrimination and oppression affects parenting practices. This was the first study that was funded by NIMH in Detroit, in which we were funded to investigate the differential impact of different levels of adaptation. What you see here is the original generation PMTO intervention exclusively focused on parenting components. What you see on the right is an intervention that also overtly addresses issues of discrimination and how they impact parenting practices, as well as addressing ways in which Latino immigrant parents experience the immigration experience, but also biculturalism challenges. What you see here is when we conducted this randomized trial, the two adapted interventions compared to control benefited parenting for all parents. There were no differences between these interventions. However, there were differences between these interventions when we look at child internalizing behaviors and externalizing behaviors, issues as depression, sadness, anxiety, oppositional behaviors. And here parents connected the dots. They said, for example, a father, I work 12 hours and at the end of the day, my employer says, there you go. And he says, wait, you just pay me 7 hours, I work at 12. Well, what do you want? Wetback? Do you want the 7 hours? Do you want to come back tomorrow? Or because I have 20 people waiting in line for you. So you take this or you get the hell out of here. That's the very common experience reported by our parents. And that father said, now I connected the dots. I am so powerless. I am so diminished. I don't have any control of that situation. But when I get home, I have a little bit of power with my kids. And before I know it, I realized I was yelling at them because I felt that little bit of power in my life. Very difficult conversations, but that has been our job in terms of as we promote parenting interventions, how is it that we can link those to a process of healing, but also supporting parents in a process of advocacy to address the oppression that they experience. So I will now move to the experience of co-leadership and co-design to turn it over to Ofelia. But these lessons that we have learned with our extraordinary community leaders in Detroit and Austin have made all the difference. Currently in Austin, we are funded by NIDA to implement a hybrid one design in which we tailor the adapted intervention that we adapted in Michigan for the Austin context. But also we have implementation science objectives of measuring barriers and facilitators, as well as implementation outcomes. So before I close, I would like to talk about the lessons we've learned along the way. The first lesson is because we cannot operate on the frameworks that many of the implementation science frameworks operate, in which parents have access to resources or the right to access resources like insurance or Medicare or Medicaid services. We cannot operate on that because a large population, segment of the population we serve are undocumented. So our funding agencies, NIMH, NIDA, have been wonderful at supporting this work from a scientific perspective. So the challenge is we work with a population that does not have many of the resources that the rest of the population have. So how do we tailor a scientific question so we can provide services? And that's how we have funded our work for the past 16 years. Essential to the process, it has been to learn from communities and community leaders to sit down and be quiet and understand the history of focus communities. And also embracing a collaboration that involves mutual trust. People have talked today about trust. I think that process takes time to develop, but it's essential. And it's also essential because you engage in several conversations in which you help understand each other's context. I need to understand the Church of Ofelia and the advocacy she's doing and the pressure she's facing. And she also has been committed to understand my context, how I need to report to IRB, how I need to report to NIH to maintain the scientific perspective of the money we have received. Also embracing the leadership of community leaders and members of the focus community has been essential, and the delicate balance between fidelity and adaptation. And I can talk more about that in the Q&A as it refers to the intervention itself. Collaborative problem solving has been essential. And with COVID, all our Austin-based intervention team collapsed due to several factors. And colleagues from Mexico City jumped to the situation to help us. And now all our interventionists are based in Mexico City as we're delivering the intervention with Zoom base. Also, commitment to advocacy is essential. With every family, we have interviews in terms of understanding if they have particular challenges and social work management that they need to receive. Some of them we have referred them for specialized therapeutic services, and we have represented a couple of families in immigration court. I just would like to honor Nancy Amador, who in the midst of the pandemic really stepped up and with her team transformed the in-person intervention to online. And thanks to them, they have really saved this project. And now we think like this about our project, a truly binational study. And I will close just by highlighting Ofelia and the work in the community. You can see here Ofelia in recruitment. This usually is the recruitment. We provide announcements in masses, as well as church bulletins. And what you see here are parents who participated originally in the parent programs, but now are becoming co-leaders with the social justice ministry in terms of owning the initiative of this programming on parenting. I cannot emphasize enough how essential has been the support of ministers committed to social justice. We have Father Jairo Sandoval here, very, very, very committed to these interventions since day one to this project. And whenever we provide announcements of intervention, the moral authority he provides is essential and really committed to helping us in terms of establishing that trust. And finally, I would like to close with this. This is a testimony by parents that is shown at the end of Mass. There's no better testimony about the parenting program in the community we offer than parents themselves. And it's beautiful when you see this testimony, but also parents becoming co-leaders along with Ofelia in this initiative. We'd like to thank the critical support from our funders and IMH and NIDA. And again, I would like to thank all of you, wonderful co-presenters, organizers, and thank you, Ofelia, for representing us in person at SBR.
Good afternoon, or could I say aloha? Okay, I love that. Thank you. My name is Ofelia Zapata. I am the community organizer at San Jose Catholic Church for our social justice ministry. I founded that group back in 2009 because I believe part of our faith values is also to look at the whole person. Yes, it's our responsibility to help people, build them up spiritually, but also in a holistic way, also be concerned about what's happening at home, what's happening in the workplace, what's happening in the schools with their children. So this is an opportunity that we're able to teach some of our Catholic social teachings and teaching all our members of our church how important it is to care for our brother, the neighbor, the stranger, the widow, the orphan, the person in prison. And so the way we engage with the community there is we do house meeting campaigns, and that's inviting people to just come to the parish hall where we have breakfast and have them have a conversation about what are the pressures on your family? And out of that, we create an agenda of issues. And the number one issue for everyone, youth and adults, is alcohol and drug abuse. And that was in 2009. And then again, we did it in 2010 and 2015, and it still remained number one. However, we could not find a way to bring some kind of assistance for those families. So then I met Ruben. I was a PTA president. I am a school board member for Austin ISD. And prior to that, I've been education advocate too. PTA president at my grandkids' high school. And that's where I met Ruben. I was hosting a community meeting around health. And then we had a conversation. I said, this is the solution. Now we finally have a way to engage the families who have been struggling with the children around alcohol and drug abuse, and being in the schools for over 30 years. It's just getting worse, not better. And so one of the steps was to have a conversation with Father Heidel with our ministry team, and inviting Ruben to come and explain what we were thinking about. And of course, Father Heidel, he's a real big on social justice issues. And we were the largest Hispanic in the South Austin area. Before COVID, we were 5,000 families. Now we're 2,000. And that's the other thing that the pandemic has done. That's just as our workplace, schools, also our faith-based institutions. A lot of people have not come back yet either. So when we do Father does the announcements, our work as leaders is to really educate the community, go to breakfasts and talk to people, and just and reconnect, try to just let people know that there's people at church that really care about what's going on, because there's still so many people in isolation. And there's still a lot of fear. So building that trust again is very important, a lot of work to do. So when we did that, then it was having parents sign up. And as Ruben showed in one of the pictures, so we get some of our members that already completed the program, that graduated, to come and help recruit. They're the best ones to explain the program to other members. What's been a challenge is that although we might get 60 people to sign up on a Sunday, we're barely able to get 10, because some are so off already that they don't qualify. They're too advanced, but they are able to still get some support from Ruben's team for those families. So that's been the challenge. The beauty of it is that parents are in attending the graduations, they are so thankful, cannot find the words to let Ruben and his team know how much they have helped them, how much it is strengthening their family, rebonding the family together, because everything outside, right, at work, all the issues around wage theft, that still continues, so we work on the social justice issues on immigration. We work with our district attorney, who now has a hotline. So anyone that feels that they have not gotten paid can call our DA, and they will go and investigate and make sure they get paid. So those are the kind of things that we try to do. We try to remove those barriers, change those systems and policies that are not even there, but there's a way to hold people accountable to the families. And so the other thing, we've met with the sheriff and also the police chief, because people were being stopped for no reason and arrested because they didn't have their papers. They have no business asking for papers. And so we have statements, and the police, the chief of police and the sheriff came to our church and let them know our officers are not allowed to do that. So do not let them do that. And if they do, let us know. So we need to do those kind of conversations so people can come out and get out of that fear. So those are the kind of things that we as community can step up and do for the families who work so hard and deserve to be treated with dignity and respect, which is what we all want, right? Um, so now I think where we want to go is continue. We're continuing. We just finished our 4th cohort. Now we're starting our 5th, and but we do want to expand to the other diocese churches. There's so many churches nearby. There's about 40 institutions in Austin that are connected with the Catholic diocese that we just need to have that conversation with our bishop. So, it is a huge need right now. And as a school board member, my district I have 18 schools, the highest mental health cases with around students and teachers, so we have a lot of work to do. That's the priority area as school board members, to figure out how we're investing our social and emotional learning funds for both, so that until we really take time to address that, there isn't any learning going to be happening. That's the barrier that's keeping everyone from learning and moving forward. So it's an investment we have to make. That's all I have. Thank you.
Thank you so much, Ruben and Ofelia. We're so grateful for your perspectives. For the remaining amount of time, we do have Dr. Iruka online. Are you still there, Dr. Iruka?
I am still here, yes.
Wonderful. I'm going to have you lead the discussant, and I'm going to turn the time over to you for that. All right.
Thank you so much. And I want to start sharing my screen. I'm so glad, obviously, to be with you all, and wish I was in person, really, because I'm in North Carolina and it's hot as bejesus over here, and I should have been in Seattle to get some of that cool weather. So I just want to thank the Society for Prevention Research for making this possible, the conveners, Brittany Cooper and Susannah Burt, as well as the amazing work of the presenters. I hope I get the names right. Please forgive me, especially for somebody who has a hard name myself. So the presenters who do an amazing job, Puni, Kekauoha, and Dr. Dillard and Kaholokula, as well as Ofelia Zapata and Dr. Parra-Cardona. So thank you so much really for the amazing work. And what I hope to do is to kind of just really sort of think through the work that you all have done in a masterful way with what I call the 3-piece framework of protection, promotion, and preservation. But before I get started, I just want to let you know I'm at UNC here, and I launched the Equity Research Action Coalition, and it really aligns with the amazing, really sort of transformative work that all of you are doing. And so the Equity Research Action Coalition is a collaborative here at UNC within the Frank Porter Graham Child Development Institute. And we're really focused on co-constructing actionable research and evaluation, which is what you all are doing. And we're really centered on Black children, starting prenatally throughout their childhood, but also really think it's important to sort of really create a coalition of Black and Brown communities. And then we work at the intersection of research, program, and policy, because we know we need all of that to really work in concert to really address the many issues that we're facing. And we use an anti-racist and cultural wealth frameworks. And I'm just so honored and pleased to see sort of the attention to both the sort of racial sort of structures that are really impacting communities, but also the cultural wealth that many communities, particularly marginalized communities, have and should be centered. And so it's amazing to just see that. So I'm going to just start and say a few remarks, and I really want to sort of give the stage to the attendees who are there, in person, to really be able to talk with the amazing speakers and the work that they've done. But I just want to sort of set a couple of stages, at least in regards to the way I'm going to frame this, my brief remarks. One is that we see a lot of racial disparities. And I'm just showing a couple of things in terms of, at least for Black people, and we also see for Latino, and we have data for also Native communities and other communities. But for the most part, we often see that communities of color are living in poverty, have food, housing insecurity, dealing with sort of loss of parents, low birth weight, preterm, housing insecurity. So you don't have to look at the data to know what we see, which is that many communities of color, and I will argue I do a lot of work with Black communities, argue that Black communities make up about 13% of the US population, but really face a multi-layered adversities that has stemmed from since enslavement and obviously till today. And we see that also with our indigenous communities, we see that with our Latino communities. And so really we know that a lot of marginalized communities are facing multi-layered adversities and challenges that's not of their own making, but the one that is systemic. And we see this really when we look at the wealth gap, right? If we think about the wealth gap, is really what you have above and beyond debt, right? So it's really, and it's earned intergenerationally, right? So your wealth is really not determined just by this year, it's determined over time. And you can see that for white families, they have 200, right now in 2022 is really close to $200,000 median household income. For Black and Hispanic families, it's closer to sort of $18,000, give or take. And so what we know is that this wealth gap is sort of an example of the disparities that exist and the complicated sort of ecosystem that we operate in. And it's important that we recognize that the wealth gap is here because of what I would say is racism, right? And I really appreciate the speakers at least speaking to how it manifests in different ways in different communities. And so I won't go too much into this particular framework, but what I do want to sort of emphasize in this framework is that racism has many, many forms, right? That there's a cultural, systemic version, all the way to the structural, and all the way to the vicarious, right? Where you experience a level of trauma if the members of your group are being affected, whether it's, when children are when you're being deported, or children are being pulled from their families at the border, right? Or when you're not able to have access to basic resources. So we know structural racism is socially engineered, right? That structured hierarchies of power creates oppression, deprivation, dehumanization. And we know that both systemic racism and interpersonal experience of discrimination, they influence the health and well-being of children, of families, of communities in many, many complex ways. And what the speakers are sharing with us is that they're trying to unpack and manage and deal and address a lot of these complex systems by trying to sort of figure out how do we address the policy, how do we address the program, how do we address access to resources, how do we reconfigure, but understanding that a lot of these are socially engineered and none of their own making. However, though, as you can see in our RISE, what I call the RISE model, which is racism plus resilience plus resistance, integrative study of childhood ecosystem, that really we have to think not just about structural racism, which we know has many, many faces and continues to morph and change. It's an endemic, it's not a pandemic, as a colleague, Rihanna Anderson, talks about. But we have to also recognize the family assets that really are rooted in the work that we need to center on, right? Which is the idea of even aspiration capital, right? The fact that even when you are still being held down, that you still aspire for better, right? And we see that in both of the amazing community work, that people are still aspiring for better, even when systemically there's a lot of engineered deprivation and oppression. We think about the linguistic capital that exists in the different languages, and I just loved hearing sort of the indigenous language being spoken and shared about how that is part of communication, but also about sharing and connection. And even things like family capital, spiritual capital, there's a lot of family and community assets that we know is critically important to the thriving of children and families and communities, and just to the general health and well-being of people who are continuing to deny full opportunity and full humanity. And of course, I think the studies really, really elevated the importance of authentic relationship partnerships. And I think I'm just appreciative to see both the university partner and the community-based partner really taking center stage, right? And not where most of the time we see the university professors and researchers are on the stage, and then the community partners are kind of invisible. And so this is really important, that we need to shift the way that we do our work in prevention science, but in other kinds of science fields, including mind and developmental science, that we have to have authentic relationship partnership with communities, especially those who have been injured and continue to be injured, because they are essential for sustaining any kind of change whatsoever. So I'll just quickly talk about the 3 Ps that I call protection, promotion, and preservation. And I'll just flag that I do a lot of work in early childhood. And so what I'm going to just show you is that when we think about protection, and again, think about the speakers, for me, I'm thinking about how do we make sure that people are protected from harm, from trauma, from material hardships. And in a lot of our data, COVID-19, I think as one of the speakers alluded to, also had a lot of disruption, right? Whether it's those who attended church-based services, engaged with different partners, we know it had a lot of disruption, including the material hardships. We see a lot of economic vulnerability that's impacting a lot of families, particularly families of color. And our data shows this level of sort of volatility, which impacts the well-being of families and communities writ large. And so what do we need to think about is how do we make sure that we are protecting families and communities from physical and emotional, from really racial discrimination, I should really say, because we know that families and communities deserve physically and emotionally safe spaces, free from trauma, violence, and discrimination, right? And they also deserve access to basic resources such as healthcare, childcare, even work protection, right? As we noted, healthy food, safe housing, et cetera. And we need policies that really begin to ensure that the disparities that we continue to see are not there, right? Whether it's through nutrition policies, housing policies, obviously health insurance, and even civil rights protection and criminal justice protections. We don't see a huge attention in that, at least in some of our early child studies. But how do we continue to push on these civil rights protections? Because the end of it, asking somebody for their papers should not be what this country is about if you want to be an exceptional country. And then I want to switch over then to the promotion, right? So how do we sort of, really make sure that we're promoting people's health, wealth, and in my case, also for young children and families, educational access and excellence. And so that means that we have to make sure people who need transportation to get to the hospital, right? In some of our studies, we found that a lot of people miss their baby well checkup or their own doctor visits because of things like transportation, things like even childcare, right? Being able to take time off work, right? So again, we need to create policies that address any sort of disparities of opportunities to address health sort of challenges as needed, or even to just take care of yourself, right? We're still in a pandemic and we still have a lot of loss in a lot of the communities that we're talking about. There was likely a lot of loss, a lot of people who are not connected as they used to be. And so how do we make sure that we address the mental health that people are likely experiencing? And so thinking about how do we think about economic stability, right? Whether it's the income assistance, we saw a lot of benefit of the child tax credit for many families, but of course it did not include quote unquote undocumented families. So again, how do we make sure that our policies are inclusive and not written in a way that really excludes people who are going to benefit the most from that? Thinking about minimum wage and other kind of asset promotion, but also thinking about the health and well-being of communities, right? In terms of the kind of work schedule, the paid family leave, the health services that are available as well, and as well as children's own health and well-being, because we do know that children are obviously dealing with their own mental health challenges early on, because obviously if your family's dealing with challenges, it may also sort of reverberate with the child as well. So how do we think about a whole family of policies that address health and well-being, and of course, access to childcare? We do see that as a big issue still for many, many families and communities, but we need to make sure that the childcare is culturally grounded, is quality, and is rooted to the community, a big issue that we still have. And then finally, I want to sort of leave you with the last piece that I think for me is even more important than everything else. Everything is important, but preservation to me is really the humanity of it all. That as we hear from the speakers and the community leaders and the members, is that we need to continue to preserve the many richness of communities that we continue to sort of slice away and dice away. And for example, in our work with Black families, we often find that they are having to sort of fight for the humanity of their children. That they have a huge concern. For example, we ask families, what is your concern for your young child about because of their race, ethnicity? And many Black families before and after and during the pandemic report the fact that they feel that their child will be mistreated or be discouraged or not have life choice or be excluded. This is a concern for Black families. And we see, not as high, but still concerns for other families of color. So we need to figure out how do we make sure that people feel really connected and included in society, because in the end of it, that determines a lot of what you feel about yourself and how you move forward. And so what kind of policies can we begin to really attend to preserve the family roots, to preserve cultural language heritage, to really ensure racial pride? Because in the end of it, we know that many, many communities are still dealing with intergenerational trauma. We see that in our Native communities. We see that in our Asian Indigenous communities. We see that in our Latino communities. And we definitely see that in our Black communities, that we are always dealing with a level of intergenerational trauma that has not been fully unpacked, recognized, and dealt with. And so how do we make sure that we really address those negative narratives and really focus on the strengths and resilience of the community, which can include things like authentic family and community engagement, invested in community organizations like the ones we are hearing who are leading the most transformative work that we have seen, really, right? And so how do we continue to invest in those kind of relationships through our policies and through our funding? So really, as I sort of now go back and listen and look at what the amazing speakers were talking about, here's kind of what I see as sort of the take-home message. So one is, we have to really have love of community engaged work, right? And I mean, I don't mean just like, oh, hug, love, kiss, kiss. I mean like real deep physiological, psychological, like really deep transformational love, because you have to love this work in order to enter the doorway, right? And I think as one of the speakers said, don't just come to the community when you are like, oh, I have a study. You need to come really already given a part of yourself in a different way. So you have to really love a community to really be engaged in that community. And I say hashtag no equity tourists needed, right? There's a whole sort of focus on now equity and racial justice, et cetera, in research. And we see a lot of people who I argue never thought about that. But now that there's money, they're now really trafficking in what we call equity tourism. And so how do we make sure that none of us are engaging in what we call equity tourism? And then I think it's also the recognition that this community engaged research is bi-directional investment, right? As a researcher, you're going to invest some time. You need to invest your time, your soul, your energy, your expertise, and the community has to invest the time too in you, right? Because once they connect to you, they do not want to lose, right? Because the level of trust is being built, a level of camaraderie is being built, a doorway is opening, that gateway is opening. And so how do we make sure that we understand that this is a bi-directional investment that should not be taken lightly, right? It's almost like this is a family, and you do not want to sort of enter a family and then break up a family and then leave, right? So how do we think about the depth of what it takes to really do meaningful, transformative community-based engagement? And of course, we hear, the speakers really, I think for me, they exude this idea of we cannot focus on fixing communities and people, but really honor their resilience, honor their community, their language, the way they function, their strengths, their talents, and their assets. I think it's critically important that we tend to often see communities based on sort of the data, right, that shows all the disparities. But what we never really show is often that cultural assets. What is their aspirations? What is their family capital? What is the social capital? What makes them thrive even under the condition of oppression, right? So this is sort of a huge part that we heard. How do we focus on outcomes that are meaningful for communities, right? In many ways, we look at certain data like, oh, how well do you do on breastfeeding? No, that's important. But really, what is the most important outcomes that the community is seeking? And how do we authentically derive that from the community, right? As the speaker sort of noted, is that we have to first make sure that it's an authentic relationship and the outcomes or the focus really comes from that relationship, right? That's driven by the community. And we hear that often, but that's not always the case. And so that means that the research and the funded enterprise has to change, right? I think what was brilliant is that a lot of the community members were the leaders of the research, and they said, hey, researchers, we now need you to come help us. You will be a subcontractor, right? And so this is where funders need to also be open to the idea that the funding, the money, the power does not have to go to a university, which we know many universities, especially if they're not sort of indigenous, HBCUs, HSIs, MSIs, if they're not sort of, we need to make sure that we're not always giving the money and the power to an institution that has often taken power and taken resources without giving back. So how do we change really the paradigm of the research enterprise? And you all have shown that this can be changed with the community driving the work in many ways. And then finally, I leave you with the idea of, the danger of a single story from Adichie, right? Which is that we have to make sure that we continue to sort of make sure that we see the fullness of a community. And I think that's what the sort of the experts, I think, really showed in many ways, is that communities have a story to tell. There is a journey, right? There is a history that's not just about, oh my goodness, the disparities, all the negative narratives. So we have to be careful that we're not always telling the single story of a community, of a group of people, but that we really show the full journey and where they are at and where they are moving, and how as researchers and community collaboration, how we continue to sort of work together to really transform not just the communities in of themselves, but also the policies and practices for the future generation. And so I'll leave you kind of with like, how do we go about doing community engaged work, at least from my perspective and the work that I do, particularly in Black, across the Black diaspora and the Black communities in particular, is one is that we have to be a better steward of history, right? We need to understand the history of the country, but also the communities that we are a part of or we're going to work with. If you don't know the history, we are bound to sort of repeat it in our own sort of researchy ways or the ways that we approach and connect with communities. How do we integrate rather than just desegregate, right? We need to really integrate our thinking, integrate the way the community functions with the way maybe research functions, which oftentimes is white dominant and sort of middle class normative and westernized. So how do we integrate fully the work of the community and the indigenous practices and languages and ways of being in the way that we also do research? And then how do we critique everything? Meaning, are we having critical consciousness, right? Being able to see beyond the numbers, to see beyond what sort of the Washington Post or the New York Times tells us about a given community or group of people. How do we critique everything in front of us, including the ways we do our study? Are we doing it in a way that is sort of honoring the history, honoring the language, honoring the land that we live on? How do we make sure that we do that? And then that means that we have to have humility of our privilege. And I say this especially to researchers, and I myself am a researcher as well. But I think it's important that we really show humility when we enter spaces, when we enter communities, when we enter relationships with communities in ways that has us recognize that we have a level of privilege, but we should make sure that we are using our privilege in ways that is not dehumanizing and that's not disrespectful. And then finally, I can't say enough that in the end of it, if we're trying to do preventative work, we need to understand the root of the problem. And many of the root of the problem, I would just argue, is racism as a big enchilada, right? If I can say that, that is one of the biggest things. But then obviously the intersection of sexism, of classism, of regionality, and so many other things, and really colonization writ large, right? So how do we make sure that our work is really rooted in addressing those systemic inequities, racism being the biggest one, and all those other intersectionality? If we are not doing that in prevention science, then I'm not sure what we are preventing. I know, so that's a sort of a shot to the bow. And then finally, I think that, you know, a lot of times we need to think about what are the different ways to do this work. And I think that the speakers really showed us we can do things in different ways, because why? We can do it and we can find better outcomes that we want for our communities and for our people. So I ask you, my question to each and every one of you is, how are you re-educating yourself about our history and the communities you work with? How are you really integrating your work, the way your approaches, your theories, your measures with the communities that you work with, really, and work on behalf of? And how much critical consciousness do you have? How much humility of your privilege do you have? Are you focused on eradicating racism with your research, or are you basically maintaining it in many ways and other sort of isms? And really, have you re-envisioned the way that you work with communities in ways that's honoring, that is respectful, that also elevates the brilliance and the genius in communities and the assets they bring to that? So with that, I just say in the end of it, I hope you can continue to become richer in the way that we work doing community-based engaged work. And I really thank you all for allowing me to appear with you all virtually, and just look forward to the conversation.
First of all, thank you for letting me be a part of this. This is wonderful. We have about 10 minutes left before the end of the session. And so I'd like to, with your permission, to open it up for questions to our panel and to those who are here online. So there is a microphone here, and I can run it over to someone if they're not comfortable. All right. Are there any questions that, or any comments that our panel would like to share? That, listening to Dr. Iruka, if that was something that sparked, there were so many things I wrote down. I hope you saw me taking lots of notes. Because I could also ask a question.
Could I?
Yes, absolutely, Ophelia.
So I think one of the things that I think would be helpful as a university, there's a lot of red tape and bureaucracy to get these things off the ground. So is there something systemic that's universal that could help move things faster? Because, you know, we had to put off and put off and put off because, you know, the university was behind, or I don't know, but I think that's one thing that kind of delayed our work. We could have done more sooner. And so that's something I would like to see. What are some of those challenges? What were those glitches that we had to hold off that we could look at as a whole system to be able to continue this work in the community? And I think it is important, you know, university is way downtown. You know, I've gone there a lot of times to speak, and I told Ruben, I wish they would give me an honorary diploma because I don't got time to go to school. But I'm very blessed to, you know, having the staff come to the church, like Ruben, you know, he's amazing. He just has this fire of energy, and so does the whole team. And so having that kind of persona, like said, as the lady just spoke, that you can feel the love that they have for this work. You have to have that gift of love. You can't say, you know, I'm going to help you learn how to love. No, you have to have that internal. People will know if it's real. And so that's so important, because a lot of our families were very, you know, and at the beginning, you know, they don't want to talk, just like the students in school. But, you know, they just connected by the second call. You know, they're ready to share. And that takes a lot of expertise in people just being very patient, meeting people where they are. And Ruben and his staff have really been amazing. I didn't say enough of that when I spoke earlier, Ruben. And so we really, that's so important. And I feel that with the panel up here too. So I know your work is very true, because I feel that love that people have to make change, that care about people, to want to help the communities. Thank you.
Thank you, Ophelia. I really appreciate that. I think that's a really good point and perspective. And I think those of you who are researchers and those who work with the university, I think that's something that we look at ways to make community partnership better. That's something to consider as you're moving forward. I did have a question because we only have 5 minutes left. And Dr. Iruka brought it up, and I'd already written down, but what are your favorite outcomes that aren't necessarily research-based outcomes? So something so this is to Puni and Adrienne and Ofelia, or even to Keawe and to Ruben. What are some things that you've seen in your projects that you take away that have enriched you?
Well, two things that you can't measure is the joy that you see in families at graduation. That is hard to measure. And hope, you know, hope that their children are going to be saved, that they are, the family is going to be united again, and it's going to move forward together.
For me, most recently, my daughter has decided to go back to school. And it was a surprise to all of us who raised her that you know, there are leaders in our community who have watched the work that we've done and realized that, you know, as time moves on, there's going to need to be that next generation of leaders from the community level that needs to step up. And she has made a decision to return, to go to college, get her degree, and go after her Ph.D. So that, for me personally and for our community, is a biggie. And what she will do, those that follow her will follow. So that's the next generation.
Thank you.
Well, I'm always in this different plane because recently we were invited to a meeting that was about a new project, a large project. And we were invited to this breakout room with university. And so it was the academic partners, and we were talking about a project and community. We were the only two, Puni and I were the only two community people in the room. And to actually have Keawe wind up being in that room and to say that if we were to move forward with this opportunity, put the community at the forefront. And we actually wound up in the room with the head of that project who said, okay, the proposal will come in from the community. And so it was submitted on behalf of the community with the idea that we put forth on training CHWs. And it felt really good to be recognized, to understand we have ideas of what we need, and to have somebody represent and say, no, it's not about academia, it's about what community is wanting to do. And to have the person in charge says, well, let's try to do it that way. It kind of flushed out where they said, you know, it'll just be one simple page, and it wasn't, but at the same time, to be able to get the proposal in and, you know, to get that response back that we're reviewing it, but just to be in that room as the only community people and not leave feeling like, why are we here? Because it's not about us. To actually leave feeling like they heard us, they saw us, they recognized us, and they recognized our ability, and they listened to the idea we had for us and allowed us to put a proposal for it. I think that was like years in coming, because it was the first time to see that happen, where we are in the room with academia and the community rose to the point of we're actually the ones submitting the proposal. And then a couple of days later to get invited to be part of their annual meeting to come and discuss it further. So I think we are moving in the right direction to equalize this academia community partnership, because we've been on this road a long time. So that to me is an outcome that we can rise to the challenge now.
Oh, thank you so much. And I hope that all of you who are working with communities or with universities heard that, because I think that's why you do the work you do. You as researchers are looking for ways to support communities and make it better, or make it, I like the word authentic in the journeys that everyone's going on. I love that. I think that these measures are not necessarily what our funders love to hear. Those are stories that I think are fantastic, and I am grateful for them all. It is 2:45, and so the time is ended today for this session. But thank you so much for that, and thank you to our presenters online and to our presenters here today. Can't do this without you. Thank you so much.